So what can healthcare practitioners do to cultivate a sense of the spiritual aspects of medicine in the 21st century that will be helpful to them? First, I would advise any of you who are healthcare practitioners, if you are and you have a religious community to which you believe, to begin to take that as your starting point and take it seriously. Begin to deepen your spiritual life within that religion. I think religion does make it easier for people to grapple with spiritual questions. It gives a person a community of faith and support, a ready-made language with which to describe your spiritual struggles as well as your joys, and practices and texts that can be starting points for a deeper exploration of your own spiritual life. Because patients struggle with the big questions. What's the meaning of my illness? Why must I suffer? Why did my daughter have to die? Is there anything valuable about me now that I'm no longer a productive member of society? Is there anything of value about me that's going to perdure beyond the moment of my death? What is broken in my relationships that I somehow feel called to fix now that my body is broken? Can my doctor possibly understand what I'm going through? A physician or a nurse or a medical social worker who's begun to explore these questions in his or her own life, I think will be better prepared to help patients struggle with these big questions. And I do think one's religion is a good place to start, because genuine religions don't give pat answers to the questions that are so fundamental to the human condition. Physicians who have taken these questions seriously will not trivialize or dismiss the questions of their patients or dispense spiritual bromides to those who struggle with the mysteries of being human in the face of illness and death. Second thing you can do as a practitioner, I think, begin to cultivate specific personal spiritual practices in relationship to medicine, even if you're not explicitly religious, and all the more so if you are. This won't be easy. The physicians in the audience will say, I don't have the time, right? And it's probably not a wise idea also for your neurosurgeon to be having a mystical experience when he's got his thumb in your cerebellum. I'll grant you that. But there are ways to do this, right? Steve McPhee, my colleague at the University of California at San Francisco, says that he just takes 10 seconds in between patients in the office. He just sort of takes a deep breath. He goes from one room to the next, takes a deep breath, and tries to center himself on the notion that the patient he's going to see next is going to be an experience of the sacred for him. That's wonderful if you can do it. I'm too frantic in the office. I can never possibly do that. You may do what I try to do, which is to prayerfully remember your patients at the end of the day. Again, quoting from Eliot, that if we had the experience, this is a way we can recover the meaning, even if it rushed by too quickly to notice when it was actually happening. Or perhaps as a practitioner, you can start keeping a spiritual journal of what happens in the course of a day. The precise method is not important. As one of my former colleagues in the Franciscan Friars said, when there's some Vatican edict saying that there was suspect about Eastern prayer forms, he said, well, I don't know, Dan, if standing on your head makes a person pray better, I'm all for it, right? So whatever it takes for you, try to do it. Third, I think we can find fellow healthcare practitioners with whom to engage these kinds of questions. And maybe, daringly for the doctors in the room, expand it beyond doctors. Bring a few psychologists and nurses into the room to talk as well, maybe some chaplains. Because the questions that we have as healthcare practitioners that we don't address for ourselves are really real. What's the meaning of medicine or of nursing? What is its value? What are right and good healing relationships about? Those are spiritual questions. They arise inevitably for believers and non-believers, for all healthcare professionals who take both being a practitioner and being a person very seriously. These are not exactly the questions you find answered or asked in the doctor's dining room, right? But silence constitutes its own conspiracy. I think we can learn from our patients, and we can also learn from each other. How do we deal with our own fallibility? How do we deal with the deaths of our patients? Can we move beyond kvetching about the pressures that we face? Can we see our work as service? Do we ever pray for our patients or pray about ourselves as healers? Have we ever experienced the transcendent even once in our work? Can such peak experiences sustain us? Is there any meaning or hope for us? Without talking about these issues, we might begin to doubt the fundamental soundness of our own spiritual struggles. To heal a person, you must first be a person. I think all of us in healthcare are spiritual beings, and healthcare is a spiritual discipline.